Hello, good evening, everybody. In spite of all challenges what we are facing in and around Howrah of West Bengal, still no network connectivity. You will not find our beloved President Dr. Kalyani sir tonight because he cannot travel out of Howrah. Now, it's a proud privilege tonight that we are completing the 50th, the half century CME, starting from the days of lockdown. And I am present at CAB, Cricket Association of Bengal, Eden Gardens now, after a hectic day of cricket and sports medicine. Now, we have a very interesting panel discussion tonight. Homeopathy. Homeopathy, we all are practicing, we all are loving, and we all are studying, and we are students throughout our life. Tonight, we are going to discuss homeopathy by 2030, where we see our beloved pathy to flourish and to be positioned in the year 2030. Today is 2022, 8 years from now on. And the students, today's students will be doctors till the end of their life. So it's very important for all the students what you see in the future. And to give details of this discussion, we have a eminent panelist queued up tonight. Our beloved alumni, the principal of Calcutta Homeopathic Medical College and Hospital, and Superintendent Professor Dr. Rajat Chattopadhyay. I'll request Orko to bring upon on the screen Professor Rajat Chattopadhyay, who will be giving his views on institutional training at first. Then we have another stalwart to be here as a panelist tonight. He is going to discuss on clinical practice and who can be better than our beloved, respected Professor Dr. Samir Kumar Bhattacharya. Then comes the field of research. Any pathy will not be flourishing without the preview of research and development. And the best in the country tonight is our beloved alumni, Professor Dr. Chaturbhuj Nayak, Chaturbhuja Nayak. Then comes a very important arena, the pharmaceuticals, the rolling of funds you're earning as a doctor, exchequer for the government through homeopathy, the pharmaceuticals, the most respected and beloved person in the bureaucracy as well as in the homeopathic fraternity, the former director of National Institute of Homeopathy, Dr. Eswara Das sir. And we are waiting for our beloved Professor Dr. Subhash Singh sir to join us. He was the inaugurator tonight, but we have so many seniors waiting for tonight's discussion, panel discussion. So we have started the program. Our beloved Subhash sir will be joining, and he will be one of the panelists where Subhash sir will guide us how NIH, National Institute of Homeopathy, the premier institution of homeopathy from Kolkata, South Lake, and also the second campus coming up at Delhi, how they are going to guide the homeopathic fraternity by 2030. Orko, can you kindly bring all the six panelists on the screen? Good evening, and my pranam to all my respected seniors and my batchmate, Professor Rajat. Uh, we are really honored to have you all on the most auspicious half century CME of National Institute of Homeopathy Alumni Association. So, to start tonight's discussion with Professor Rajat Chattopadhyay, but before that, there are a lot of uh, queries which I hear from the students. We are studying homeopathy, but where do we find ourselves? How will earn money through homeopathy? How will flourish? After 5 years of BHMS, 5.5 years, we have to go for the MD, post MD. Where will we go? How will earn money? Job arena is very less. So, what are the arenas we can explore upon? So, these are certain queries which came all through for last few weeks after we published this topic. So, to start with, over to you, Professor Rajat Chattopadhyay.
Very good evening. Very good evening, Dr. Bidyut Mukherjee. Uh, my to all of my esteemed seniors, all the other panelists present today's program. Uh, my regards. And first of all, I should congratulate Dr. Bidyut Mukherjee, Dr. Kalyani, and all the alumni of the National Institute of Homeopathy to organize such a CME in a regular fashion. And it is the 15th day, so it is my proud privilege to be here. And I feel honored to be here as one of the panelists. And the topic today, what is decided, that is homeopathy in 2030. But as an anchor or as introducer, Dr. Bidyut Mukherjee pointed out some points regarding homeopathic education. And as per today's topic, this homeopathic education, I have to say something on homeopathic education, the current status and vision in 2030. So, what we have been observing in homeopathic education now since few years, all the students entering in this field, in this BHMS courses through passing NEET examination, and that examination is competing with all the others. That is a single examination for modern medicine to Ayurveda, homeopathy, etc. So they have to cross that barrier, and then again during post graduation, they have to pass the special Ayush Net examination. So some competition is there, and it is the vision of the policymakers that to be a very good quality of students. Quality of students should come in homeopathy, not only the quantity. So on the vision, what we have been observing last 4 to 5 years, even more than that, that quality students are coming. They are coming with few are coming with a definite aim, and few without knowing anything, and they have been after coming in the BHMS course, they are in a fix that what to do, because most of the with the plus 2 science background, they think that they become confused with some syllabus of our BHMS, and it is our faculties, esteemed faculties, they will take the all responsibilities and they will take all the pen to make them familiar with our philosophy, with our homeopathic philosophy, with the all 8 allied subjects. So the real what I feel, that the students, they are very much interested in all the allied subjects as well as in homeopathic subjects, but whenever it is in integrated way, whenever we can integrate this homeopathic system, that is materia medica, organon, or repertory, whatever our homeopathic subject we have, the 4 subjects, that we have to integrate in a such a way that the learning should be not like separate feeling, that this is the allied subject like anatomy, this is the allied subject like physiology, and this is the separate subject of homeopathy. This is the one problem from it is in the BHMS level, and I think this problem is little bit the solution is there. We have resolved through postgraduate education. Through postgraduate education, the concept of this integrating now advanced one syllabus in the PG, that is the advanced homeopathy in the fundamentals of homeopathy. The integrated concept is there. So we have resolved little bit in postgraduate part, but in undergraduate part, still this is the problem is going on. It is one part. Another one, another one that was in the syllabus, the anatomy and physiology, with a huge section of students. They come, enter into the BHMS level, and they got very few months for these anatomy, physiology, and the homeopathic subject familiar. So within 1 and 2 years, they have to make familiar with our concept homeopathic, which is really dynamic in nature. and which is in the metaphysical level. So it is it is very tough one to be familiar with our homeopathic philosophy. But in the same time, we have to do this with from the first year onwards. That's why our proposal was, and still now it is the proposal, that the organon of medicine and the mathematica, all the homeopathic subject, not only should be introduced from the very first, whenever student is taking entry, they should know what is our mathematica, why I read mathematica, why I read organon, what is the relation between the organon, mathematica, and the allied subjects, why we should read anatomy. So the induction classes, these are very important, and I think all the college teachers, all the college faculties, all the highest principals, like all the policymakers, they should give very much important in the introductory class, in the induction class of these first years, because this is the time when the student come with zero experience in homeopathy, and within the very 6 months of 4 months, 6 months time, they will get they have to familiar with homeopathy. So the first impression is very important. So in these induction classes, that all the faculties and the administrators and the policymakers, they should give much more importance. Like first year, in the fourth year, in the during the internship period, what is the aim, what is the homeopathy, how homeopathy can be applied, it is the real form. That is not one student is very much fond of surgery and he will not be a surgeon, or he will not be a pathologist. He has to do with homeopathy. He has to practice homeopathy. Either he will be a homeopathic academician or will be a researcher. So, whatever may be, the application of homeopathy is very much important. So, whether the student, after 4.5 years BHMS courses, and then after completing 1 year internship, whether they have learned something to apply homeopathic in a proper way, this is the very important thing. So like induction classes in the first year, just to make familiar, just to be a boost up, just to become confident one, the importance must be given. In the same time, during the internship period, this is a very good time, because all the students get stipend, and they are very much mature enough. So within these tenure, 1 year tenure is not, it is big tenure after 4.5 years. This tenure, we should give them the proper training with the hospital bedside training and clinical teaching, because all the students, they show interest in the clinical teaching. Whenever we say anything, the student about anatomy, physiology, pathology, practice of medicine, gynae, surgery, obstetrics, they show him very much interest. But that interest cannot be reflected in the homeopathic part, apart from few exceptions, few very good faculties in very many colleges, and all those teachers are very much expertise, and their application, their teaching method, that should be followed, that should be followed by all other junior lecturers, all other policymakers, that how they can create interest in the students in these homeopathic basic subjects. And also the junior teachers or the faculties, all, they should carry out in different state, different type, because it is with our more likely 300 colleges, so it will be different in different states. But they have to find out the solution, how they will make a very interesting one, the homeopathic subject. It may be pharmacy, it may be repertory, it may be organon, it may be mathematica. So one part that I have told already, to just to small summarize, that is the first one, introductory part, the induction classes. The second, within these 4.5 years tenure, the homeopathic subject oriented teachers, just to make create interest in very many fashions, and with clinical teaching, organon in the bedside, mathematic in the bedside, it is written in the routine, it is written as per NCH or CCH syllabus, but it is not followed accordingly. I think strict vigilance by the in charges, by the academic in charges, by the policymakers, they have to take very strict vigilance on this part, that whether the clinical bedside part, bedside application of mathematica organon is followed or not, because only theoretical going organon, mathematica, repertory, it will be of no value during their practice life. So whether what is Dr. Bidyut Mukherjee was telling, he is absolutely right, that few students say what to do after BHMS, whether we will get service or not, whether we will be a practice or good practitioner or not, whether we can do research or not. The reply is one: if anyone know homeopathy, what homeopathy is, then he can do practice in a very good way. He can do research. He may be a very neonate in the research, but with the days and under the supervision of the very seniors, they will become expertise, or they can be a very good homeopathic academician. But all for these three, for being academician, for researcher, or for practitioners, the very basic thing, the sound knowledge of homeopathic basics, the sound knowledge of homeopathic philosophies. It is not only organon of medicine, it is comprising of mathematical organon repertoire with the application and with the knowledge of pharmacy. These are of utmost importance. Whenever you will be deviating from the very basics of homeopathy, whether you will be very master in unallied subjects, you may be the teacher of pathology, you may be a teacher of medicine, you may be a teacher of anatomy or physiology, but being a homeopath, being a homeopathic faculty, or being a homeopathic student, or being a homeopathic researcher or academician, deviating from homeopathic philosophy, they will you can't do anything. For a time being, you may do anything, or you may do anything which should not be called as homeopathy. So this is one of the most important part. Now, only we will give stress on the basic homeopathic principles and basic homeopathic, the all theoretical part, and we cannot show that how the cure occurs and how the applications of mathematica. I know very senior like Dr. S.K. Bhattacharya is there, Dr. Nayak is there. How wonderful prescription is there. The student want to see the result. So in the bedside, in the hospital OPDs, in the IPDs, these senior expertise patient skills, whatever skills that one student has to be has to be earned, has to be learned. It cannot be earned, it can be learned only, and learned only through regular education, through regular reading the books, regular be updates, and regular following what your teacher is telling. So without bypassing anything, the these the society is now going very fast, and it is very tough to make pace with this fast life. So everything is fast. It is not only in homeopathy, it is not only in this profession, in all profession, everything, they they want result, and result at a once. So we have to make, on the basis of our basic philosophy, we have to make some fixed modules. We have to fixed on homeopathic oriented modules in on allied subjects, and that allied, not separated from homeopathy, only for anatomy, only for pathology. Everything should be, the module should be comprising of homeopathy, and the application of it should be from the third year, fourth year, and internship period, even if it is the house stuff period. So that should be implemented. Then only, then only all the students will get confidence. Now the students are not getting confidence because they have not sound sense, the sound knowledge about the homeopathic basics. They only read homeopathy just to pass BHMS. Exceptions are there, but most of the students read philosophy or mathematica just to pass the examination. But what is the real meaning of the lines of mathematica? What is the inner sense of organon? How that inner sense of organon in theoretical part can be applied in the clinical part? That is to be learned during the clinical period, during the internship period, during the house staffship period. That part should be, so the bedside teaching, the clinical training, the internship training, these part can be, we can start it from the second year onwards. It is written that OPD attendance from second year or third year, but usually it is not happening in most of the colleges. So the number of the patients in the OPDs and IPDs should be increased in all. And I know every faculty, every teachers, every medical officers, they can do it. Only then the students will be benefited. The students will be very much confident when they will see that the patients are curing, and in their OPDs, in their IPDs, in the chambers of the doctors, in the outside. So there are very much acceptance in the society. The peoples love homeopathy, so we are. So why in the institution we are failing to do so? It is very much it is very popular in the society, among the private practitioners, in common people. But whenever we become institution, like from National Institute, I know National Institute of Homeopathy, we have passed out from NIH, we have seen a lot of patient queuing, 2000 patient, 1000 patient, whatever. Also in Mahesh Bhattacharya College, DND College, Calcutta Homeopathic Medical College, UP, in most of the UP colleges, in Kerala, Kerala private colleges, government colleges, in very many colleges, Nehru College, there are so many patients. There is no lacking in the patient in most of the colleges, or few colleges. But the intention of the students just to eager to learn something, and the faculty's part, they have to create new and newer techniques, evolving techniques, some innovative ideas among the students to create it. Right now, whatever the students right now, they are fond of not books, they are now fond of smartphones, they are now fond of some social medias. So you have to make your small videos on the applications of mathematica, on the application of organon in the clinical practice, and that can be shared with the WhatsApp group, with the YouTube channel, with this within being a faculty of one college. But you have to be very updated, and whatever is occurring, that the research studies, that should be also reflected in our education, because education and research, that should be a very it is not like parallel line, it is very much linking. So what is the result of the research, and why the research study we have been the protocol, on what basis this protocol is being prepared, it is also important. Because without, by deviating from the homeopathic philosophy, I am not only talking about the cardinal principles of homeopathy, but why it is homeopathy. On the basis of those principles, we have to fix the homeopathic protocols, we have to make the research protocols, and the study, whatever the small study or big study, the big study may take time, but the result of those, that will be reflected in the society, in the community, that will be reflected also in the colleges. So the college students can realize what is the real effect of research, whether research is going on, and the publication of the research, it is not known to the students. We have seen the students, it is now Central Council for Research in Homeopathy are taking initiative on this. Now students research program is there, SPSH is there, some all other 2 3 programs is coming, but it is very new one. Till date, it is a very tough challenge to us to making these research and education linking, the linking of these two, and that should happen from the college onwards. That should happen from the college onwards, from the BHMS level onwards. The aptitude of the student suddenly will not develop during postgraduate period. Whenever he has already completed the 6 years or 7 years of life in the undergraduate without having nothing in the research aptitude, and you think that with the 7 years undergraduate background, they will suddenly develop research aptitude within 1 year. This is very what I say, immature thinking idea. So the research aptitude, the thinking aptitude, just from second year onwards, now the students are quite mature enough. They are coming through NEET. They are quite mature enough. From second, and he or she would be a doctor. So he or she has to take responsibility. So from second and third year onwards, these aptitude should be worn up. The question, the framing questions, the critical questioning pattern, critical questioning, these are of utmost importance. They should know that how to make the critical questions, why research is made for. Research can be started from first year onwards, but the right aptitude is important. The one student may show very good interest in research, another one in only academic field, another one is practitioner. So the policymakers and the administrators, the higher esteemed faculties, they have to identify the students, that by whom the which one will go to that part, another one will go to that part. These are of importance. So I think I may summarize that we should read the very basic philosophy, and we should not deviate from homeopathic philosophy. If we if we stick in our philosophy, then no one can fail in homeopathy, whether in practice, research, or education. This is one. And the application of homeopathy, how how these senior persons, they become expertise, that skill will not come within only 5 months, 6 months. That is a regular process, continuous process. And one thing I must say, that CME, it is in the name, continuous medical education, but that will be continuous medical education will be in the every level. That will be in the academic level, that will be in the practitioners level. The practitioners also should remain updated, because all the pathological investigations, the approach, the disease entity, the pathogenesis of the disease, it changes with the time. So the practitioners also should remain updated with this CME. The academician, they have to remain updated, and the researchers, because this is a new thing. But I must say one thing, that one researcher should have, whenever he is a homeopathic researcher, he should have a solid homeopathic foundation base. So the way, your education in basic homeopathic part is of utmost importance, and challenging to the teachers to evolve interest in the students in these homeopathic subjects. And the researcher challenge, that is to linking homeopathic education, and the challenge to homeopathic educationalists to make these education, to making their protocols, how to fit these homeopathic philosophies in that protocol. It is not that you will make one protocol and in that protocol you fit homeopathy. That protocol should be prepared as per homeopathic orientation. If it is not possible, then we should be, the research should be more on these. How can it be, I can say you some examples. Whenever you will talking about miasmatic dyscrasias, the students may not show interest, or miasm, it is very old term. But whenever you will speak about human genome studies, whenever you will tell about the even Ayurvedic genomics, whenever you will tell about the individuality concept with the personalized concept of the modern science, whenever you will talk about the accessory circumstances in the context of modern days epigenetics, then the student will show interest, and they will then again try to make the work, assignment, dissertation on these connections of homeopathy with the modern science. And I feel honor. I feel very much proud that I become homeopath, because all the philosophies of homeopathy right now, when I was student, the situation was not like that. But right now, with the advent of science, the homeopathic philosophy, much more, you can say that explanation, the holistic concept, the holistic explanation with the psychoneuroimmunoendocrinology, concept of miasmatic dyscrasias with the human genome project and individualization concept also. So all these concepts nowadays can be claimed as this is the advent of science. So it will not only remain within philosophy. Ultimately, the science now will explain few philosophical part of homeopathy, and homeopathy will become science. Then all these questions will not arise, and I think Dr. Bidyut Mukherjee will not say that the students become very much confused what to do after BHMS, or the if it is matter of only service, then it is not only in BHMS, it is in all sectors. It is in all sectors related to service in all over the world. But if you compare the service percentage of homeopathy in comparison to other general profession, then we are in much good position. So how to boost energy, how to give the confidence to the student, and how to be remain update, that is also one part of faculty to make them a very confident one. Thank you.
Thank you, sir. Just hold on. Our host is about to come. Due to the internet issues, he just went by. Thank you, sir. So, our next speaker will be Dr. Professor Dr. Samir, and I'm bringing him up on screen to continue with his part. Over to you, sir.
Good evening. My best wishes to all the participants. I thank to the organizers, particularly Bidyut Mukherjee, Dr. Kalyani, who are organizing these seminars. and has given me the opportunity to speak before you. I believe all the participants, they are the cream of the homeopathic society, because you are the product of NIH, the best clinical institute in homeopathy at present, I think, in the world. So, whatever you understand, whatever we understand, I think there is no basic difference in it. You know your duty, but as a speaker, I will tell, as per their request, what should be the clinical approach, clinical treatment by 2030, as they have requested. One thing I am telling you, the clinical approach as it was during Master Hahnemann's time, as it was the next century, as it is today, it will be the same in 2030. And if a truth, if homeopathic clinical system is a truth, and this truth cannot be changed, clinical practice, research will change, our approach will change, our diagnostic methods will change, our research method will change, we will develop many new homeopathic medicines. We will understand the reactions and actions of the medicines in different way in future. But so far the clinical approach is that will not be changed, and it was and it will remain the same in today and in 2030 also. Now, before coming to the clinical practice, I want to just remind you what is clinical, what is the term means clinical as per Oxford Dictionary. Clinical word, it is mentioning relating to the observation and treatment of actual patient rather than theoretical or laboratory studies. Now, next word came automatically, observation. The observations from the Oxford Dictionary, it is an act of measuring, questioning, evaluating, or act of clinical judgment to perceive a patient before you. This word perceive, what I see, the main motto of clinical practice for a homeopath. It was in Master Hahnemann's time, Kent's time, it is now, and it will be in 2030 or beyond it, to perceive a patient. That is the duty of the physician. As a student, it was your duty to perceive the homeopathic materia medica. It was your duty to perceive each and individual drug. Now, when you came to the clinical practice, it is your duty. The patient has come before you. You are to perceive him. Only mechanical case taking will not give you the perception. For perceiving, your all the senses will have to work. All senses. I will give some example. From those examples, definitely you know it will be gradually clear to you. Now, first, I told you sight, perceived means come to realize or understand patient by using sight, sound, touch and smell. Now first I come to the sight. What we observe from our eyes. When I was a student, I am telling you, our teacher, you have heard the name of Dr. B.K. Bose. He was taking the class, and who knows him, they will know that his class was not mathematica or organon or anything else. He used to jump from one idea to another. But whatever he used to tell, if you could observe it, if you could listen to it patiently, definitely something used to come out. One day, suddenly, he ran to a student, girl student, and hold her head just like this and told, this is, you see, this is sepia, this is sepia, this is sepia. Now, when he was telling this, we all saw it, we observed it, and whatever I perceived and whatever my friends perceived, I don't know. It may not be same, but whatever I perceived, that there was a male type of hair distribution in that girl. Male type of distribution of hair. So when he was telling it, we saw it, we observed it, and in my clinical practice, I am telling you, the entire case taking I have done, and I have seen that type of male type of hair distribution in a lady. I had to think twice for CPR, and many cases I have seen the rest of the symptoms are following like that of CPR. So this sight, this observation leads us to a correct conception, correct perception of a patient. So the perceive of the patient is most important. It was important in the past, it is important now, and it will remain important in future. I am giving you another example from another stalwart, that is Dr. J.N. Mojumdar. When I was a teacher, at time I was a teacher of Metropolitan Homeopathic Medical College and Hospital. That time I was practicing, and in my clinic some lady came, aged about 60, 62 like this, and she came for skin disease, severe skin eruptions, severe skin eruptions. My, there were some doctors, assistants who took the case, and after taking the case they used to discuss amongst them, because this was our teaching in NIH. When I was a student of NIH, our class used to be taken by Dr. J.N. Kanjilal or similar Dr. S.P. They used to tell us that you take a case, discuss amongst yourselves, separately you take the case, discuss amongst yourself, and you see ultimately you will come to a same conclusion of a selection of the medicine. When all of you, all the 16 students will come to the same conclusion, then only you will understand that your learning of homeopathy is complete. So we used to follow that. So here also in my clinic, I used to tell them to take the case, discuss and decide a medicine. And they discussed and decided a medicine for that lady and came to me with this case report. Now I heard from them, and they were in the opinion to prescribe graphitis due to the severe skin disease, all the symptoms like this. It appeared after the menopausal age, and this became more healthy, more obese after that. So all the symptoms they selected was like this. I heard patiently, they discussed among themselves. Then I told one thing. You have taken the case properly. Whatever you have told very nicely. But can't you see pulsatilla amongst her? I see pulsatilla amongst her. Now, when I told this, that lady suddenly told me, Doctor, one thing I did not tell all of you. When I was at the age of 17 or 18, like that, I was suffering from suddenly some pain in my knee. I was taken to the modern, that time, hospitals. They diagnosed me as osteogenic sarcoma and they wanted to amputate my leg. You remember, imagine a 17-year girl I am. I was approaching I was thinking that myself will be married, I will have a good, happy life. Now at that stage, I heard that I am suffering from carcinoma, osteosarcoma of the knee bones, and it will be amputated. My legs will be amputated. So I did not agree. I have started crying. I will die, but I won't amputate. So they took me to Dr. J.N. Kanjilal. Sorry, Jan Mojumdar. J.N. Mojumdar. Sorry. So Dr. Mojumdar, similarly, the case was taken by all the juniors. They took me to Dr. Mojumdar, and Dr. Mojumdar told them, don't you see pulsatilla in her? And he prescribed me pulsatilla 200, two doses only. Gradually, my that swelling, pain disappeared. Afterwards, I was taken to the hospital for examination, and that time, few years back, no sarcoma was found there. And you see, still now I am living, and this is only thing I have developed after my menopausal age. So you see, you have taken all the cases, you have jotted down all the complaints, you have taken the modalities, everything. But your observation to a particular patient showing something, some portrait, you have to perceive, you have perceived the patient. That is, it is her all movements are like pulsatilla. The constitutional C is pulsatilla. And C again I prescribed pulsatilla 200, afterwards 1 m, and gradually her symptoms was relieved. So this is what I wanted to mean. For clinical practice, I have told you sight. Sight is most important. Now another example I am giving for sight. Few years back, almost 15 years back, one patient was brought to my clinic on stretcher. She was almost unconscious. Almost means unconscious. Only some parts were moving. That patient I observed her. Case was recorded from the surroundings, and we came to know that she was suffering from carcinoma of the pancreas. Patient is unconscious, so I cannot ask her any question. I just observed her, and then I had to take the decision. One thing I observed, and that is also a teaching of Dr. J.N. Mojumdar. My father was a homeopathic doctor, and he used to attend Dr. Mojumdar as assistant or some as a doctor. So he told me his some cases regarding this. So I heard it and learned it. That I found that lady, even in unconsciousness, taking her fingers to the navel and touching the navel again and again, and her hands are taken away by the attendant. Again, the hand finger is coming on the navel. So, observing these symptoms, I prescribed her Sina 10 two doses, and gradually that lady recovered her sense. She started living gradually normally, and she survived after that at least 15 years. Then she again suffered from some problems and died. So these type of observations will lead you. Now another observation, touch. I have told to perceive, touch is another point. Now I am telling you, one man came from Jalpaiguri to my clinic with a severe, painful hemorrhoid, and it was so severe that even he could not keep the clothes on it. So when I was examining, I have found that when I was going to touch it, sorry, by the temperature, sense of temperature, the anal area was being squeezed, and I prescribed for this sensitivity muriatic acid 30 few doses, and the patient improved. I will tell you another case of Dr. C.S. Kali. You can see it in book, but this observation, the hearing, it is most important. One patient, he used to practice in Dhaka, Bangladesh, now Bangladesh. But he was a great homeopath. He used to prepare his own homeopathic medicine himself and practice. So he was a great observer of that time. Now what happened? He was taken to see a patient who was suffering from fever, delirium, and almost at the verge of death. That man was being treated by all good doctors from the surroundings, from the allopathic sides, medical college. They told that the patient is going to die, take him to the home. So they took the patient home, and that time Ganga Jatra was the prominent thing for the this type of deathbed patients. So Ganga Jatra was given. That means he was kept outside the home room with her head to the Ganges, so that she can go to Ganga. So that stage only they allowed a homeopath to see the patient. And that homeopath, Dr. C.S. Kali, was taken there, and he used to go with cart with all his books and medicines, this and that, and used to stay there till the patient is recovered, or he is told that you are not to stay, you can go home. He used to stay there. So he went with this. He observed the patient. During delirium, the patient was one prominent advocate of the Dhaka, and during delirium he was always talking about his cases and pleading to the judge with correct English, with correct clauses, and with correct all the points he was describing in the delirium, and high rise of temperature, and the patient is almost with the bed, nothing else, no movement of hand or no movement of feet, no nothing taking orally, but he is in a delirium. And the most important thing to notice there, that all the deliriums were in correct and in proper, as if he is pleading in the court. Now, Dr. Chandrasekhar Kali translated these symptoms as a religious mania. Religious mania means who not only for God, everyone's profession is to serve the God. As a homeopath, your God is in front of you, your patient, you are to serve him. Yes, definitely you will take money. Definitely you will take something. But that is afterwards. First thing is you are to see your patient. You are wholeheartedly observe your patient and you are to see your patient. Similarly, for one advocate, that is his God, his religious, is in the court and pleading. Who he observed it like this. Now, after observing this, he prescribes stramonium 30 to that patient. No result within few hours. Few hours passed, no result. Then he prescribed, he thought the potency is too low, so he prescribed 200. But he was sure that this is the symptoms and this will cure the patient. So he went to 200. But 200 also failed. No change. The patient is gradually going on worse and worse. One day, full day he observed. Second day he gave 1 m fast. Nothing. No improvement. Then he thought that my medicine is not wrong. This cannot be wrong prescription. Probably his vitality is not suiting to the patient, to the potency I have given. So what to do? He came down from 1 m to stramonium 1. He prescribed stramonium 1. Gradually that Ganga Jatra was stopped and the man became completely all right, and after that he started his practice in the High Court. So this is the observation made by Chandrasekhar Kali, and even if sometime I have observed such things in some patient, I have given and I got the result. But the potency selection is also another part, clinical part, in which potency you are to give. What will be your potency? What will be your patient who is suffering from diabetes, mellitus, has come to you, initial stage, you have selected some medicine. What potency you should try? What potency you should give? Those are the important things. We should study. We should understand. In one patient, if we fail, second patient we should try. And we should develop our own way of thinking and own way of selecting potency and our own way of repetition of the medicine. Everything is related. And your clinical practice, your selection of remedy, everything depends on it. So, this type of selection of potency is very, very important for your case. Now, one another observation I am telling you, because this case taking and repertorization, that you are master of it. But all my students, I believe, they are all very much practiced with it, and they are master of it. And I am proud that my students, even my colleagues are there, my juniors are there, even my students. Now you have heard just few minutes back Dr. Rajat Chattopadhyay. They are my students. I am proud to feel that, and they are good clinicians. They know it. So I am not going to discuss about all those things regarding preliminary things, because you, the who are present, who are participating, you are master of it. So I don't want to waste the time on it. Now another case I am telling you, observation. That time I was the director of NIH. Some patient called me that one patient was in the hospital. They told it was a coma, renal failure, and now the patient is on coma. I think some of you students who is listening me were with me that time, went to see the patient. Now when I entered the patient's room, because he was brought from the hospital, they told the patient is going to die within few days, some limited days, and take him to the house. So he was taken, he was there, and they requested me to see if I can do something. I observed everything, because patient cannot tell, only hearing from them. After I heard, I first, when I entered in a room, I saw that room is not so much oriented, clean, this, that. But when I entered the patient's room, usually the patient's room becomes some altered. But here I found that everything is in a good position, everything, nothing was in some misplaced. So I asked, you have maintained the room like this, your patients? His son told me, sir, we are afraid if my father's consciousness comes and he sees even the calendar is not in proper position, it is some altered, he will start shouting and he will go to make some danger thing. So I asked, is it? Yes, sir. He wants everything in order. Even we should talk in order, we should spend our daily life in order. That means we should not miss our breakfast, we should not miss our dinner, we should not miss our lunch. Everything should be in proper time. After that, I told, yes, I understood your father. I don't know what will happen, but I shall try. I came back, gave him 5 ml arsenicum album 30 liquid. Why liquid? Because the patient is unconscious. I told them, take some drops on the cotton and rub it on his feet. So they started doing it, and some olfaction, give some, he is taking breath, so some olfaction without touching. So gradually, after few days, they told, sir, I think there is some consciousness is coming back. The patient got back his consciousness within few days. He survived well, taking food with, yes, there was a severe diarrhea after that, because renal functions could not be restored, but the body rejected the water through diarrhea and he became lean and thin. The edema went, but she survived for few days, 10, 15 days he survived normally. Then again he went to coma and succumbed to death. So this observation at least gave him some useful life because it was beyond pathological stage, it could not be cured, so ultimately the patient expired. Now, I think I have taken much of your time. I will only just add my another experience to you, then stop. That time, one of my student, lady student, came to me for the treatment. She was suffering from severe dysmenorrhea, severe metrorrhagia, absolutely irregular types of menstruation, and profuse. Even she took all sorts of modern medicines. By giving some medicine, it could be stopped for sometimes. After stopping that medicine, again it starts. Even pain could not be stopped. She went for homeopathic treatment to all my senior colleagues, my teachers, but failed. Then she came to me and I heard her because she told that she had never such type of complaints. Few years back, she was going for some work in a auto, three-wheeler. Suddenly she found that from the front one lorry is rushing towards the auto. The auto hit her auto, the lorry. She became unconscious. She got her consciousness after long time in the PG hospital. There she got best treatment. All fractures, all injuries were healed up. Everything was all right. Pain, this, that, everything. But she developed this. So when I saw the prescriptions, I found somewhere hypericum, somewhere arnica, all the injury medicines were given to her without any appreciable changes. So I started thinking because you see, only listening to the complaint, only observing the symptoms, only taking the things like this does not. Sometimes you have to apply your mind to correlate why it happened. One thing came to my mind that when a lady saw she is in an auto and a lorry is rushing to her, where is the injury first? The injury first in her mind, fear of death. So I prescribed her aconite napellus 10 few doses. Gradually that pain subsided. Gradually that dysmenorrhea was recovered. Then some antipsychotic medicines were given, not antipsychotic. Only some antipsychotic medicines were given. And I found gradually she became all right. So the observation. Now, auditory observation, I am telling you, in your clinic, when you will see the patient is waiting in the queue and you are sitting in your room, you will see that the child is coughing and coughing and coughing. And by hearing that sound, you will understand that this child will require aconite, this child will require moxol, this child will require phytolacca or drosera or whatever it may be. So you will have to adjust your ear. So what I want to tell that be it 2030 or be it 3000, whatever it may be. For your clinical practice, the only thing that you will have to understand the totality of the symptoms by perceiving the patient. You will have to understand totality of symptoms does not mean numerical aggregation of the symptoms. That numerical aggregation of the symptoms can be done by machine will do. You won't need to remember all the symptoms in your brain. Only you adjust your mind where you can find it out, in which book you can find it out, in which repertory you can find it out. Your mind, you adjust it. You need not remember all the symptoms. I am telling you, I am a bad student of Mathematica. I don't remember all the symptoms as my students remember. When I used to go to the class, I used to call Dr. Musa, please tell me about this drug. She used to tell, and when I went to class and took the class of my own way. So that is I am telling. But perception, when you read pulsatilla, you have to understand what is pulsatilla. When you read CPI, you will have to understand what is CPI. When you read Maxwell, you will have to understand what is Maxwell. Each and every medicine should be perceived by a good homeopathic physician, and then only he can prescribe that medicine. Similarly, when you take the case you are in your clinic, you have to perceive your patient, what the patient's party is telling, what the mother is telling, they will exaggerate it. They will, every guardian wants that his child should take so much of food. Every guardian wants that his child should be first in the class. So they will talk on their way. But you, the physician, you will have to perceive what is the fault in this child. Who is making the child sick? Whether his mother, whether his father, whether their surroundings. Who is making unnecessary pressuring, unnecessary? You see nowadays these so many suicides, so many different types of mental diseases in the young stars, so many metabolic diseases in the young stars. Why? Due to excessive stress, excessive strain given either from the guardian side or from the friend side or from the girlfriend or boyfriend or from the teachers. Even teachers, we teachers also sometimes responsible for giving unnecessary stress to the student and make them sick. So who is responsible? What is responsible? If you can understand this, then you have perceived the patient and your prescription will cure the patient. Thank you for listening to me, and thanks to the organizers for giving me scope to tell before you. And if you have any question, you can ask through Dr. Mukherjee, Bidyut Mukherjee, their program, and I will be able to answer. Thank you. Thank you very much.
Thank you so much, sir. Thank you so much. We had learned a lot, and by all your blessings, I somehow had been getting net back at my home. Now, next, Lalit is also there. Good evening, Lalit. It's
Good
over to
evening,
you. You
Beta.
please continue with the next speaker. I just reached
Yeah,
home.
sure, sure. Sure. First of all, I would like to thank Dr. SKB sir, who happened to my teacher also, for giving a wonderful lecture on his clinical experience. He has shared the essence of his enormous clinical practice, and I'm sure everyone who is attending this particular webinar would be highly benefited by the information shared by the sir. I also agree that homeopathy is a Guru Vidya. Whatever we read, that is not enough. If you really want to become a prescribing machine, the best prescribing machine, that is only possible if we spend some time, if we learn homeopathy under the guidance of the expert like sir. Thank you very much, sir, for your guidance and sharing valuable clinical knowledge with us. Now, our next speaker, he needs no introduction, a well known figure in homeopathy, Dr. Chaturbhuj Nayak, sir, who happened to be my teacher also. He was a former principal of Dr. Abhin Chandra Homeopathic Medical College and Hospital, Bhubaneswar, former Director General, CCRH. So, sir will be sharing his lecture on the research aspect of homeopathy. I heartily welcome sir in this webinar. Over to sir.
Good evening to everybody. At the outset, I must congratulate the office bearers of NIH Alumni Association, Dr. Bidyut, Dr. Kalyani, and by inviting resource persons like Dr. Rajat, Dr. Bhattacharya, my friend, Dr. Eswara, my friend, and I'm very happy to see also Dr. Lalit after so much time. And particularly for deciding this theme, that homeopathy by 2030. And my domain of discussion is homeopathy research by 2030. And before going to, or while focusing on our vision for homeopathy research by 2030, I think it will be pertinent to go back to 2005, August, when the famous medical journal Lancet published an article against homeopathy, branding homeopathy as a placebo response. Then there were some efforts taken by Central Council for Research in Homeopathy to counter this challenge, and we wanted the help of some very senior scientists from reputed research organizations of Kolkata, and one was School of Tropical Medicine, where to study the where some collaborative study was taken up, collaborative research study was taken up to study the efficacy of belladonna in preventing Japanese encephalitis virus infection, both in vitro model, that is on coriolanting membrane, and in vivo model, that is on albino mice, that is albino rat or mice models. And the results are quite encouraging that belladonna 200 could prevent JE virus infection both in coriolanting membrane and also in mice model. Secondly, we also took up another study at Bose Institute, Kolkata, to study the effects of homeopathic medicines like phosphorus, silicea, sulfur, arsenic album on cancer cell lines. And the results showed that these medicines could produce apoptosis of the cancer cells. Like these studies on in vitro model, in vivo model, other research studies were also taken up on plant model and animal model to rule out placebo response. But let me tell you here one gray area which could not be explored in the past, that is how belladonna 200 could prevent the action of JE virus, and how this phosphorus, silicea, sulfur, arsenic could produce death of cancer cells, that is called apoptosis of cancer cells. How aspect we could not address. So that is now the need of the hour to address by 2030 and beyond 2030 also, how these things happened in the laboratory model or in the in vivo model, mice model. And all the things should belong to the domain of basic research. When you think of basic or fundamental research, we have to also address some of the areas like the modus operandi of homeopathic medicines. That means how the homeopathic medicines act. Second thing, the pathway of action of homeopathic medicines. And third thing, by applying the knowledge of nanotechnology to determine whether there is presence of original drug substances in the higher dilutions of homeopathic medicines. Of course, Professor J.S.R. Bellare and his team from IIT Bombay they have already determined that they could show that there is presence of nanoparticles in the higher dilutions of homeopathic potentized medicines. But what they did, they only found out the effects of the medicines from metal origin. So now what we have to do by 2030, we have to extend such type of study beyond metals and to go to plant, the medicines of plant origin and other sources. Then fourth thing, we have to see the immunomodulatory role of homeopathic medicines, whether they rejuvenate the genetically informations or this immunomodulatory role of homeopathic medicines, that we have to determine. And the next is exploring the antimicrobial actions of the homeopathic medicines and whether the homeopathic medicines kill the microorganisms directly or they make them inactivate or they inactivate them by raising the host immunity. The another area under this basic research is exploring the mechanism of homeoprophylaxis. That is how influenzinum prevents influenza, how arsenic album prevents COVID-19. Another area of basic research is determining the shelf life of homeopathic potentized medicines, because you know everything has a shelf life and we have to determine the shelf life of homeopathic medicines also. Coming to the second domain, that is clinical research. We know a lot of research studies have been done in the field of clinical research, but still we have to continue this type of research by, of course, by using more rigorous study designs, preferably randomized controlled trials. Another area we have to explore in the field of clinical research is to study the action of specific homeopathic medicines in a particular disease condition. That is called clinical homeopathy. That means, for example, study of the effects of rustux in filariasis or study of the arsenic album in COVID-19. So these are the things to be done in the domain of clinical research. Then another very vital thing we have to do, scientific validation of the doctrines or the fundamental principles of homeopathy by adopting modern scientific parameters. But what Dr. Bhattacharya has told, I also agree, that without detrimental to the doctrines of homeopathy. So by adhering to the doctrines of homeopathy, we have to validate scientifically the fundamental principles of homeopathy, because there are so many skeptics and critics of homeopathy who do not believe in our fundamental principles. And another area is, next area is in the area of drug standardization. Here, what we have to do, study of the phytochemical parameters of the exotic plants vis-a-vis indigenous plants. We know that due to variations of the climatic conditions and environmental conditions, there will be definitely changes in the ingredients of the plants which are cultivated abroad when compared to the plants cultivated in Asian countries or including India. So these phytochemical variations need to be determined and documented. Another area is determination of pharmacokinetic parameters like the absorption, distribution, metabolism, elimination time, drug reaction, and related toxicity of homeopathic drugs. So these pharmacokinetic actions or pharmacokinetic parameters, particularly of drugs of plant origin, are to be studied. And in case of drugs of plant origin, what we have to study, their authenticity of the plant material, their purity, their contents, that is levels of phytochemicals, their safety, and also efficacy. Coming to another area that is very important, that is called drug proving or homeopathic pathogenetic trials, where we have to reprove our drugs which are proved almost 200 years before. particularly the drugs of plant origin, because their their ingredients which were present in those medicinal plants 200 years before must have been changed in the present context due to variations in the climate and environment also. So this will help if you again reproof those drugs. Again, if you reprove those drugs in the present context, then that will update our knowledge of homeopathic materia medica. Then most of our homeopathic drugs were proved on the Europeans and Americans who are genetically different from the people of Asian countries, including India. So those drugs need to be reproved on healthy human volunteers belonging to Asian and Indian continents, Indian countries, in Asian countries and India, including India. Then proving of tautopathic drugs, that is also very important, because these tautopathic drugs, including the antibiotics, the steroids, and other conventional drugs, we have found that if you can potentize those medicines and give to the patients, they can also yield some favorable results. Then the fourth area of drug proving is proving and reproving of lesser known drugs, including sarcores, nozodes, including bowel nozodes, and other lesser known drugs. Coming to plant research, this is another important area, because many of the plants, particularly exotic plants, they are becoming gradually extinct, they are vanishing. So we have to cultivate the exotic plants in our own soil. For example, in one of the centers of CRH at Utti, they used to cultivate Cineraria maritima succus and other exotic plants in a bigger scale. That habit also we have to continue. That type of study we have to also continue. Then another area under this plant research is pharmacognostic studies of the medicinal plants we have to do, relating to physical study, physical action, physical properties, chemical properties, biochemical properties, and biological properties of medicinal plants which are used in homeopathy. And coming to animal research also, I have discussed with some of the experts of veterinary sciences who are also very much friendly to homeopathy. They are the members of the Scientific Advisory Board of CRH, and they have suggested that we have to do some research on acute disease and chronic disease of animals also. And regarding acute disease, the bovine mastitis, then calf diarrhea, calf pneumonia, diarrhea in poultry, these are some of the areas where you have to do in veterinary research. Coming to chronic disease, the skin disorders and allergies of dogs, respiratory disorders in case of dogs also, and cats, arthritis of dogs and horses. Another most important area is drug manufacture. So we have to decide the uniform guidelines, how to procure and store the raw drug materials, the method of potentization, and preparation of mother tincture, and preparation of higher potencies in homeopathy. And second thing is, in this area of drug development, is harmonization of homeopathic pharmacopoeia. That is very, very important, because different homeopathic pharmacopoeias available today, they have all their pros and strengths and limitations also. And we have, by doing harmonization, we can prepare standard homeopathic pharmacopoeia which can be available around the globe and which can be followed by all concerned. And another area under this drug manufacture is determining the effects of succussion on quality of medicines, the effect of containers on the quality of medicines, then transfer of quality of medicines when the medicines are transferred from one medium to another medium, that is from alcohol to globules. Then difference between manually prepared homeopathic medicines and manually potentized homeopathic medicines, and those medicines which are potentized by potentizers digitally. And another area is quantification of the forces to be applied during succussion. Coming to literary research, what we have to do, we have to update our materia medica and repertories, and in the light of modern advancements in the different allied sciences. Then improving the quality of our journals by making them indexed and also peer-reviewed journals. Then translation of important homeopathy literatures available in regional languages, from regional languages to English, we can translate so that it can be accessible to all parts of the homeopathic professionals around the globe. Then contribution of stalwarts of homeopathy, that also we have to document. And development of e-books also. In the field of literary research, we have to develop e-books also. And finally, the documentation of research outcomes and disseminating to the homeopathic professions so that it can be utilized by the clinicians and the practitioners. And lastly, what is to be done? What is to be done to achieve such type of homeopathy research by 2030? We have to, all the homeopathic institutions, they have to sign MOU, Memorandum of Understanding, with the reputed research organizations, and we have to collaborate with them. We cannot do alone because we have some strengths, but we have limitations regarding the high cost, high standard laboratories, the instruments, equipments, the expertise of modern medicine and other gadgets available for fundamental research we don't have. So we can collaborate with the reputed institutions, and we have to interact with the scientists, with the experts of other homeopathic disciplines, other allied disciplines. And I agree with Dr. Rajat, who was telling also, and Dr. Bhattacharya, that he was also telling that we have to, the time has come for integration of homeopathic teaching with homeopathy research and with practice. So there must be integration between education or teaching, research and practice. And I think NIH is the best platform, NIH is the best institute where such type of integration can take place. Thank you very much for giving me opportunity to give my inputs for homeopathy research in different domains by 2030. Thank you very much.
Thank you so much, sir. Also, please bring on Lalit, sir.
Yeah, thank you very much, sir. So, for sharing visionary areas for research in homeopathy in future. Since my college days, I am observing that sir was deeply involved in research activities, and he was inspiring us all the time to carry out some research activities, to publish article. And even today, sir is working in the area of research in homeopathy, which is very important to establish homeopathy in a scientific forum and to give homeopathy scientific basis. Without research activities, it is not possible at all. जैसा ही कहते हैं कि ऊपर वाला जब देता है छप्पर फाड़ कर देता है, तो आज जो क्वालिटिव स्पीकर्स हमें मिले हैं, डॉक्टर रजत चटर्जी सर, डॉक्टर SKB sir, Dr. C Nayak sir, Dr. Yashodas sir, and Dr. Subhash Singh sir. In my view, it is once in a millennium combination, and exactly it's happening today. So our next speaker also a very renowned personality in homeopathy in India and abroad. He has served a very long term as advisor homeopathy in Ministry of Ayush. He was a former director of homeopathy, National Homeopathy, Kolkata, and sir has given various lectures in the National International Forum. And he is none other than Dr. Ishwardas sir. So I invite sir to take over the stage and to give his lecture in the pharmaceutical aspect of homeopathy in the year 2030. Welcome, sir. Over to you.
Thank you, Dr. Lalit. Thank you, my predecessor speakers, Dr. Rajat, Dr. S.K. Bhattacharya, Dr. Chaturbhuj Nayak. Thank you, Dr. Bidyut, Dr. Kalyani, Dr. Subhash Singh, all my great colleagues. In fact, I'm not going to have a lecture on homeopathic pharmaceutics, but I would like to share some of my thoughts on the contemporary practice in homeopathic pharmaceutics and how best homeopathy can cope up with the demands in 2020, 2030. I have some few slides, but I don't think that it is going to be the time may not permit me to share all my thoughts. So I'll jump as quick as possible in sharing my thoughts. One thing which I have observed in being the last the last but one speaker in this panel discussion, that there is a demand from every corner that a lot of science have to come into homeopathy, in both in clinical practice, both in research, both in academics, because Dr. Rajat represents the highest authority in academics. Dr. Chaturbhuj Nayak, an authority in homeopathic research, and one of the finest clinician, Dr. Bhattacharya, but clinician come teacher. They all shared their thoughts. One thing which I want to tell you is on the day one when I entered into homeopathic institution in 1967, my teacher used to tell that homeopathy is a science, art, and philosophy of medicine. But unfortunately, in our teaching, we have not defined what are the science in homeopathy, what is the philosophy in homeopathy, and what are the art in homeopathy. Art and philosophy, yes. Our teachers are vocal and they give a lot of explanation, critical explanations to our philosophy. And that is the basis on which the homeopathy survives today. That's one of the fact remains that homeopathy is surviving because of its cardinal principles and staunch practice by eminent practitioners. We have been facing severe criticism from every corner on the scientific basis of homeopathy. Dr. Chaturbhuj Nayak has mentioned some of the initiatives and demands for streamlining the research. Yes, those efforts will definitely give way to make homeopathy more popular in 2030. The biomedicine which we see today is 100% scientific. They want to say that we are the scientific medicine, we are the modern medicine, we are the scientific medicine. They have very less on art of practice as well as in philosophy of medicine. But homeopathy, there is a lot of philosophy in medicine and some art and very less in science. So we have to bring a lot of science into that. Science is there, a lot of science is there in homeopathy. And as Dr. Rajat has told that the best of the brains are coming to homeopathic education now. Possibly it's one of the greenest period in homeopathic education period, but we are getting the best students with scientific background, scientific fervor. They are coming to our institution, but some or other, that sort of a continuity of their scientific fervor is not maintained in homeopathic education. We have to bring not only the science in the basic subjects in medicine, but something very peculiar to homeopathy, something like nanopharmacology we have to introduce, something like human genomics we have to introduce in our curriculum, both in undergraduate education as well as in postgraduate education, because the human genomics and epigenetics is a very, very important to medical systems like homeopathy. Unless now we start this sort of a scientific orientation to that, we may not be able to create a cadre of homeopathically oriented researchers and homeopathically oriented good teachers to teach the science of homeopathy to our students. This is an introduction. I want to talk something about this. Then straight away I will go to the homeopathic pharmaceutics. See, homeopathic pharmaceutic is an ocean. I don't know how to present that. When Hanuman introduced homeopathy, we had hardly 100 medicines, 100 homeopathic preparations. Now we have about 4,000 homeopathic preparations, classical preparations, homeopathic classical medicines available available in the literature. I don't know how much it is there in the practice. Almost about 3,800 to 4,000. The number is increasing. About the inventory of homeopathic medicine, the homeopathic inventory, if we say only the classical medicine, about 4,000 classical preparations in various potencies. Each of these medicine has at least about a minimum about 5 to 6 potencies. So about 4,000 into 5, 20,000 preparations are there in homeopathy. That includes mother tincture, a lower potency like 3SX, 6, 30, 200, 1. All these medicine, 2,000 medicine may not have, 4,000 medicine may not have all the potencies, but an approximation is about 20,000 medicines, classical preparations in homeopathy. This is the inventory of classical homeopathic medicine. This includes the homeopathic medicines which are fully proved, reproved, and clinically verified, and partially proved, empirically proved, or clinically observed, or introduced in homeopathy through some certain literature. All these are there in this 4,000. All the 4,000s are, though we call them all homeopathic medicine, all these are not based on are introduced based on the homeopathic principles. What the homeopathic principle says is the medicine should be the one which has undergone the human pathogenetic trial or human drug proving, and it has observed the clinical efficacy of that in patients. If these two criteria are fulfilling, then they become a homeopathic medicine. But unfortunately, we have introduced the homeopathic medicine, which are the one which has been proved and clinically verified, and so many other medicines have been introduced. They're all called homeopathic medicine. Apart from this classical preparations, about 20,000, there is another group of medicine. We have biochemic medicines, we have beach flower remedies, we have so many other preparations in the name of homeopathic medicine. Then again, another fallacy is that there are 3 different types of drug dynamization: decimal scale, centesimal scale, 50 millisimal scale. Though Hahnemann was not the one who introduced decimal scale, it is one of the commonest commonest medicine available in the market. So we have a decimal potency, centesimal potency, and 50 millisimal potency. All these standards have been prescribed in the pharmacopoeia. Now, 20,000 classical preparations by name, and each of them have these 3 different types of preparation. When I say that I admit that all these medicines are not finding in all these 3 different scales of preparations. But what I want to emphasize is the inventory of homeopathic medicine is going to such an extent that it becomes unimaginable for any evaluations. Commonly in our medical practice, we may not use not more than 30, 40, 20, 50 medicines normally. We may use rare medicines. There are few people who uses rare medicine, but there are commonly this for common ailments and common practices, very less number of medicines are being used. Now, if the proportion of the introduction of new medicine increases, in 2022 we have, this is the inventory which homeopathy has got, and what will be there in 2030. And there is a competition to prove medicines on empirical basis. And in Germany, the land of Hahnemann, the Berlin Wall, which was a wall which is there separating between the East and West Germany, people have taken medicine, the sand of that Berlin Wall, and potentized and introduced as a homeopathic medicine, Berlin Wall potency. This is said to be used on emotional separations and good for creating emotional unity, because the Berlin Wall was demolished and now there is a unity. Tear is potentized and being used. So if these sort of medicines continue to be their introduction in being introduced over a period of time, our inventory is going to be unimaginable in 2030. We have to do something to control it. I talked about only the classical preparations. Then there are biochemics, there are mother tinges, there are proprietary medicines, there are combinations, then there are formulations. And the formulation is the one where homeopathically dynamized medicines in higher potencies 30, 206 or different medicines are mixed and formed medicines in the name of certain specifics. Common cold medicine, gastric medicine, these are all in high potencies. Without any drug proving, these are all being marketed. This is having a large share of market in homeopathic medicine. So on one side, there is a classical homeopathy and there is a proprietary preparations on the other side. And the combinations are the one where the physiologically active or pharmacologically active medical substances are used to prepare certain medicines like cough syrups, certain tonics, etc., where mother tincture or lower potencies are mixed and prepared. The reality in practice is, in homeopathic pharmaceutical is, there is a classical preparation, there are classical preparations, there are combination preparations, there are formulation preparations, there are biochemics. All these are continued to be these are being continued to be expanding. In late 80s and early 90s, before the good manufacturing practices was introduced in homeopathy, we had about 854 manufacturing units in India. This was on record. 854 manufacturing units in India on homeopathy. And the good manufacturing GMP was introduced, and gradually what happened, the number of manufacturing unit has come down to 373. Few years back it was 373 or 74. Out of this, the major players are about 20-30. They are the one which are there having a market in homeopathy. Others are preparing small medical, few medicines and marketing it. And the demand for homeopathic medicine is definitely increasing. Definitely increasing. One of the study in USA shows that there is a demand of increasing. There is an annual increase of about 20% of homeopathic preparations. Homeopathic medicines are not well regulated in USA. It's almost all medicines are being marketed as OTC products. And still, the market share of homeopathic medicine is increasing by 20%. In India is also not bad. In spite of the fact that there is huge resistance from several corners, the market share of homeopathic medicine is increasing. And how far the market is going for classical preparations and proprietary medicines or cosmetics in the name of homeopathy, all we don't know. We don't know. We don't have made any analysis of that. So, if this sort of an unregulated exponential growth of homeopathic preparations are going on, which are unimaginable, something need to be done. Otherwise, all the effort which the educational front and in the research front happening may not get that much of a advantage for the growth of homeopathy. We have to regulate the homeopathic pharmaceutics. We have to find out a way how best we can regulate it and make the homeopathic medicine as homeopathic medicine. There is a need to differentiate between homeopathic medicine and homeopathic products. And in Ayurveda, in an allopathy, there is something called a homeopathic formulary. Formulary says these are the preparations under this schedule, these are the preparations under this schedule, these are the preparations under this schedule. They have put medicines in different schedules, and the regulatory mechanism for each of the medicines are also different. Unfortunately, the homeopathic pharmacopoeia, Indian homeopathic pharmacopoeia, doesn't have such sort of a classification. We have only the standards for preparations of certain medicines in our homeopathic pharmacopoeia. It is true that the same thing is there in all other pharmacopoeias. We have at least 7 standard homeopathic pharmacopoeias in the world. One is Indian homeopathic pharmacopoeia, second is British, third is USHP, fourth French, fifth German, sixth Brazilian, and 7 Portuguese, Mexican. No, Mexican is Spanish and Brazilian is Portuguese. All these 7 pharmacopoeias are there, but in none of these pharmacopoeia, there is a difference. There is no differentiation between what is homeopathic medicine and what is homeopathic product. So, in the name of homeopathy, lot of preparations are being marketed in the name of homeopathy. So if somebody markets an unregulated medicine, which is not scientifically proved, the onus of the merit or demerit of that preparation falls on homeopathy as a whole. If somebody markets a cough syrup, which contains sort of something which are not homeopathically safe, actually, one of the greatest advantage for homeopathy today is in comparison to the biomedicine, or the only reason why we are growing faster is because the safety of homeopathic medicine. At least the label of safety in homeopathy is unchallenged so far. If this sort of an unregulated market goes on exponentially goes high, there is a threat to homeopathy that if some preparations brings out a bad name, that will the bad name will fall on homeopathy. It will not fall on that preparation. This exactly happened in Sri Lanka. I worked in Sri Lanka. I know that there was a preparation, a asthma a preparation made by a homeopathic pharmaceutical one, which for mainly meant for respiratory distress, and that medicine was very, very popular, very, very popular, and that has brought homeopathy to a higher level in Sri Lanka at one point of time. But unfortunately, some drug regulators found that these medicines contain something which are a little harmful to the health. Whether that detection was scientifically established or not. But this fellow who marketed this medicine didn't defend that, and this medicine was banned there, and then that has brought a bad name for homeopathy in the island of Sri Lanka. Exactly, this has happened in USA in the recent past. One of the OTC product which was given for the teething problem of children, the teething drops or something, which was containing belladonna 3x, which was said to be not safe. So the FDA, Federal Drug Authorities, have taken action that they are proposing that all the homeopathic preparations need to be registered individually with FDA. As on now, for preparation of homeopathic medicine, there was no separate registration required, but this single preparation has brought in bad name to the homeopathy in whole of USA. For Indian homeopaths also this could happen. So the only option for us is we have to separate what is homeopathic medicine and what is homeopathic product. The responsibility of safety and efficacy of a medicine, which is homeopathic medicine, the safety and efficacy of homeopathic medicine will lay with the government or the agencies, and the safety and efficacy of a homeopathic product which will lay with the manufacturer. If we can make it, at least if some point of time, if something happens to a homeopathic product, homeopathy as a whole may not get branded as something dangerous. This is one point. The one option which I put forward is that if the homeopathic medicines can be classified into different schedules. Schedule 1 could be the mother tinctures. Schedule 2 could be the classical preparations which are proved and therapeutic efficacy has been established. Or 1A can be mother tinctures, 1B could be the one which has proven efficacy, 1C could be the medicines which are not proved but used in homeopathy. And biochemy could be put in another group. The homeopathic formulations could be put another group. Combination could be put another group. Homeopathic cosmetics could be put in another group. And clearly defined legal provisions are assigned to each of this group. At least we will be able to regulate homeopathy much better than what it is today. This is a this is an idea which is there. We have to debate it, and possibly NIH is one of the platform which should evolve policies on regulating homeopathic medicine also, because you have postgraduate department in pharmacy, and you have a separate good pharmacy department. NIH should come up with the ideas on policies. NIH students are excellent. NIH faculties are good. NIH has got a solid established name in homeopathy. They should prepare policy. They should put policy guidelines on education. They should put policies on research. They should put policies on drug regulation. All these has to come from an academics. Then only an academic institutions will become an institute of excellence or an institute of national importance. National Institute of Homeopathy cannot be one among the 2,200 or 300 colleges in India. It should not be. It should not be. It should be one of the premier institution. It should raise its status to an national institute of national importance, not even an institute of excellence. If at all it want to raise to that at 2030, all our effort, my effort, all our predecessors, successor, our alumni, we should see that we should put forward the NIH in the forefront as an institute of excellence, an institute of national importance in homeopathy. And we should force the government to establish at least one institute of excellence in every state, under the umbrella of National Institute of Homeopathy. Now, the government is establishing All India Institute of Medical Sciences in every state. Why can't there be an institute of excellence? One in mental health in Kottayam we have. One could be one in respiratory diseases in another place. One could be on skin diseases in another place. One could be on clinical oncology with homeopathy in another state. All this, an umbrella-like institution should come under National Institute of Homeopathy with integrative approaches on teaching as well as on research. Then only the homeopathy will be able to attain its status in 2030. If our idea is to make homeopathy much broader base, we should introduce science-based education. At least 30%, let us say that 100% of homeopathy should, out of 100%, 30% science, 30% philosophy, and 40% art, or 35%. Now, the scientific aspects of homeopathic teaching, in scientific teaching, is only very less. We have to bring a lot of academics into scientific teaching in homeopathy. Then only we can translate or we can motivate those students to homeopathic research. Science-based thoughts will come. The teaching institutions should become the incubation centers for ideas. And in NIH could be an incubating center for good ideas on research. And then definitely our onward journey will be much easier. It's a high time. I think I have taken reasonably good time. If time permits, I will come with this idea on development of a homeopathic formulary in another session, and that we can debate it and discuss it and formulate it in a much better way. Thank you very much for each of you, every one of you, for giving time and being a listener, at least in these odd hours of night. Thank you so much. Good night.
Yeah, thank you very much, sir, for sharing the pharmaceutical aspect of homeopathy. Obviously, it's a good news that the production of homeopathy is increasing by 20% internationally and also in India. You have given a very good description and differentiation between the homeopathic medicine and the product. As you have said very correctly, that standardization of homeopathic medicine policies and things are very important to take homeopathy a step forward. And in that, NIH really plays a vital role, being the premier institute in homeopathy in India. Thank you very much, sir. I think your vision and your opinion will help us to move forward.
Thank you, Dr. I was trying to go ahead with the question and answers for the question, but I think I had shared the questions, only two questions with Dr. Lalit. You can take up the questions to the respective panelists. Dr. Lalit?
Yeah, yeah. Let me see, sir. Let me check the questions. I think this question uh, will be for Dr. Eswara, sir, and the question raised by Pran Govinda Chaudhary, and he has raised a question: are our fascinated homeopathic pharmaceutical companies must obtain such protocol of HPI for the sake of Hahnemannian homeopathy within 2030? I repeat the question: are our fascinated homeopathic pharmaceutical companies must obtain such protocol of HPI for the sake of Hahnemannian homeopathy within 2030? Dr. Das, sir, this question is for you, I think.
Yeah, actually, I didn't get well with the wordings in that. If our fascinated homeopathic pharmaceutical companies, I don't know what he means it. But if his question is whether the homeopathic manufacturers have to follow the HPI
Yeah,
for
yeah.
Hahnemannian homeopathy within 2030. Then we have, I told that we have a homeopathic pharmacopoeia of India, HPI India, which mentions the standard of preparations of about 1100 homeopathic medicine. I told there are about 4,000 medicines which are there in the literature. Out of that, about 1100 medicines are there in the homeopathic pharmacopoeia of India, HPI. And we also accept the standards mentioned in all the other six pharmacopoeias of the world. We also accept the standard mentioned in Mexican pharmacopoeia, Brazilian pharmacopoeia, USHP, BHP, all pharmacopoeia we accept it. But there are no standard for the patent proprietary medicine combination and all these preparations. They are all flooding in the market as parallel products. There is no regulation. But when his question is regarding the Hahnemannian homeopathy, I say it is classical preparation. For classical preparations, every homeopathic company has to follow the standard mentioned in homeopathic pharmacopoeia or homeopathic pharmacopoeia for India or any other standard pharmacopoeia in the world. So they have to do it. Classical preparations already done, and we have also introduced the GMP, good manufacturing practices. They're also very strict. The norms to be maintained in the preparation area, preservation area, the stocking area, all these are well mentioned in the GMP. They're all there. That is why many companies which were not able to meet the standards came down. That is how the number from 854 has come down to 373 after introduction of HPA, after introduction of the GMP in homeopathy. And definitely more strict regimes and regulations will come in the future. That is bound to come. Thank you. I think I'm clear with this answer.
I think, yeah, I think Mr. Pran Govinda Chaudhary must agree with the clarification given by Das, sir. His doubt must be clear by this time. And Bidyut, where is the second question? I'm not getting the second question. If possible, you can read the second question.
Otherwise, even if there are questions, you can send to us and we will definitely try to reply to that.
I
Okay,
want
sir.
to say something. I want to say, Dr. Lalit,
Yeah,
my
yeah.
son, yeah. I just want to say one thing that Dr. Ishara has rightly pointed out about the excellence, center of excellence.
Yeah.
Just I want to say regarding the uniformity, not only in uniformity, the excellency in the education purpose. So National Institute of Homeopathy may be one of the pioneer in this field to be a center of excellence in education purpose, because the education purpose excellence or whatever it may be, that should come from one academic institute. And just
Mm.
similarly, it is from research institute, from the research one on the academic institute, everything is apart from academic institute only, and
Yeah.
in that academic institute and that research institute there may be a common for the expertise in the practicing skill. So the standardized homeopathic practice and standardized homeopathic education, there may be two separate institute or in one national institute like institute, in which that may be one of the center within 2030, if you think for the vision, because it is very much need of the hour to make it standardized in practice or whether it in academic field also.
Yeah, what I suggested was let us have at least one institute of national importance, an umbrella organization, and get connected with one institute of center of excellence on specific diseases or areas in each of the states. We have about 20 to 28 states or 27 states. And homeopathy is there in every state. Why can't we have one institute of excellence? Now we have one institute, National Institute of Mental Health in Kerala. Like that, why can't we have one on homeopathy has got a lot of expertise or strength in mother and child care. We have, because in one of the best area for homeopathy is the maternal and child health, on skin diseases, on viral infections, on respiratory allergic disorders. So many things are there, and that academic institution could be a specialized institutions for teaching, training, as well as for research. This could happen. This progressively we have to evolve that sort of a strategy, and this should be achieved progressively, so that at least by 2030 the status of homeopathy will definitely be different.
Yes, sir, correctly said. So far NIH is concerned, in NIH is not only important for in academic interest, NIH is equally important in the clinical area, because NIH is the only institute in homeopathy in India, what I can say, where we have a very large number of patients, a patient with different kind of diseases. So in National Institute, we can have, as presently also we have different OPDs with a different kind of disease conditions. So what I think, the areas where the a particular kind of disease is more, that particular institute or that particular hospital may have a specialized OPD for that particular conditions. So for NH is concerned, we have cases of cancer, we have cases of gynecological disorders, we have joint disease, we have diabetes, we have hypertension. In that way, we are having different kind of we have clinics where we are running different clinical conditions. So academically as well as in the clinical point of view, NIH can play a vital role because we are strong enough academically as well as from the clinical point of view. So all the three areas are possible: the academic teaching purpose, the clinical part, and the research part. All the three areas are possible in one institute at a time, and that is NIH, because we are strong enough from all the areas to achieve this target, I think.
Anyway, let us have a vision paper for 2030
Yes,
for NIH.
sir.
At least the
Yes,
alumnus
sir.
should sit together, pen down certain points, a vision statement for homeopathy in 2030. You can at least put this as an agenda for next few seminars and evolve certain consensus and certain points. Put forward together and get it approved through your SFC and GB,
Mm.
and get it.
Yes, sir.
For NIH to get all these things are not different, but you need to
Yes, sir.
have that background note and background paper ready for you.
Yes. Thanks, sir. Thank you very much. I think so. Dr. Bidyut, Dr. Bidyut Mukherjee, are you there in the studio? Dr. Bidyut Mukherjee, are you there in the studio? So, our last speaker, Dr. Subhash Singh, sir, are you there in the studio, sir?
Is it there?
Hel- Hello. Yes, sir. His name was there in the list of speaker. So whether sir is there or not, I am not sure. Sir, are you there, Dr. Subhash Singh, sir? Sir, are you there? Dr. Subhash Singh, sir, are you there in the studio? Dr. Bidyut Mukherjee, sir, are you there? If not, then I think with a lot of thanks to all the speakers and all the listeners who are attending this webinar, we may end up this session by paying our respect, our deep respect to all the stalwarts and very renowned figures in homeopathy, those who have given their consent and have given their time to become speaker in this webinar. Really, it is from the tip of my heart, but I feel that it is once in a millennium combination. Because it is not possible to get all the speakers of this class at a time in a platform like webinar. So I think with this word, uh, we say goodbye to all the
So,
speakers and listeners.
namaskar to Dr. Ishwar Das, Dr. Nayak,
Namaskar, namaskar. thanks,
and,
So see
thanks.
you
and,
all in Vishwa
and my
Bangla in
love
November
to Dr. Lolit
2020.
Singh, Dr. Bidyut Mukherjee, and all the participants who are listening to us. Okay,
Thank you.
Yeah.
good
And
Thank
night.
thanks
you.
to Dr. Lalit. Thanks to Dr. Lalit for
Thank
his
you, sir.
nice
Thank you.
words.
Thank you, Sinayak, sir.
Uh,
Thank you,
Am I
Sinayak, sir, my
audible?
teacher.
nice to
Yes.
hear you and also see you. See you virtually.
Thank you,
See
sir.
you
Thank you very
virtually.
much, sir.
Thank you, Lalit. Thank you, Dr.
Thank you.
Bidyut.
Thank you.
Am
Thank
I
you,
Dr.
Raj,
audible,
sir.
Nayak.
sir?
Thank you, SKB, sir. Yeah, Bidyuta, you're audible. You can continue.
Okay, thank you so much because there are a lot of network connectivity challenges through and through. And thank you so much, Lalit, because at the 11th hour, 12th hour, we had requested you to host the show. And it
And you
was a
did a nice
very
job.
Herculean
You did a
task
nice
to
job.
go on at the last moment. And our beloved Kalyani sir cannot join because of the network blocking issue in Howrah district. So it's been an excellent discussion tonight. And as we had been discussing with Eswara sir, Dr. Nayak sir, Rajat, and as well as our beloved S.K. Bhattacharya sir, that we may extend the discussion in our next episode because there might be further questions which need to be answered, or there might be some other issues which we are expecting from the audience because only two or three questions were there. Lalit, I had sent you the second question on the chat box. It was from Dr. Beni Madhav Shaduka. Probably the question is for Professor Rajot. Homeopathic teaching must start with essay on the new principles 1976. That what I had copied from the YouTube.
No,
Homeopathic teaching must.
I have gone through that question. That is not question. What I feel that Dr. Shadukha, the inner sense was something different. He was also very studious and he very senior one in the profession. Dr. Shadukha is also alumni of NIH, and he want to say, I think that the very basics. What I also pointed out that we are deviating from the very basics in the name of advancement, in the name of science, whatever may be. We may be very scientific. Definitely, we have to go update. We remain scientific with all the paraphernalias of the science society. Everything is right, but deviating from the basic principles that should not be done. In that sense, he may write down that it should be started from the very basics one because right now in our students in the UG level specifically, I will not say in postgraduate level, in UG level, these is a very common phenomena, and that's why he probably just want to say that ABC of homeopathy should be known to all. That is the with the sound knowledge of basic principles of homeopathy, and homeopathy not only basic principles, sound knowledge of homeopathy. One should be a good researcher, good academician, and good practitioner. That is the sense of is that it is not in the literally sense that 1796 homeopathic should start. I think what I feel.
Thank you so much. Thank you so much, Professor Rajat. And we have a lot of things more to discuss and to ponder upon. Like a lot of questions came through, which couldn't be done on the first episode, like the integrated approach, how we can have our homeopaths work in at tandem with the allopaths in the hospital or during the pandemic or during certain epidemics. during certain emergency issues, but that cannot be done in one episode. We are expecting to have the second episode with obviously this panelist. We are requesting them to be with us along with few other panelists which the audience can request upon, and we'll be approaching all the respective panelists to be here on with our 51st edition. And we hope that internet connectivity stays safe. We have Kalyani sir with us, whose thought process brought all of us together, and he had this idea. I was just discussing with Kalyani sir that we are thinking of, like in cricket, Saurav Ganguly started Vision 2020 5 or 7 years back. Now I started this CME from CME itself. The second part came that Vision 2025 or 2030. Now, I was discussing with Kalyani sir that what our students think, because a lot of people are trying to deviate from homeopathy. They want to go for some this field or that field. No field is harmful, but basic homeopathic knowledge, acquired, being a doctor and imparting the knowledge for the benefit of the society, that at large need to be attended upon. So, a lot of queries. I think the viewers will be going through the episode once it goes on the playback mode.
I think Dr. Bidyut, that may convey the wrong message. It is very few percentage may shift to the another profession apart from living homeopathy, but very few. And if it is all in the profession, it is in the MBBS, it is in the Ayurveda, it is all. So if our BHMS student, they can shift for any administrative job or in any other management job, then it is okay. In the management field, in the administrative field, if they have the homeopathic orientation, that will be better for us. But it is not that the more than 60-70% student is leaving homeopathy. 5 to 10% student, if leave your profession and opt for any other thing, no harm. That is not bad for homeopathy. I think it is my personal opinion.
I agree with you, Rajat, and there are a lot of avenues we need to ponder upon, like sports medicine, like hospital management. Already, a lot of people have done hospital management because we need good hospitals. It may be with integrated approach or with only homeopathic approach, but we need certain things, regulatory factors, a lot of things. We need to ponder upon this, and our main guide. So many mentors are here, like Eswara sir, who is having a lot of innovative ideas and thoughts, had been with the government sector since so many decades. He will also guide us. Our Nayak sir, Chaturbhuj Nayak sir, is there with his ideas. Our young dynamic Rajat, who is being instrumental in doing a lot of fundamental works. So the viewers will have a lot of questions. We are expecting our second episode to be more bubbling with a lot of new thoughts. A lot of you people say about the integrated approach, but the integrated approach, what you mean to say, you all can write in our chat box in the YouTube once the stream gets over. Now the live chat is going on. Once you go on the playback, you can write your queries over there. We will try to amalgamate all the queries which come through our WhatsApp mode or through the YouTube chat mode or in other Facebook or any other digital mode. We will be trying to amalgamate all these queries and we'll be placing to our panelists. So once again, I thank on behalf of Kalyani sir and all the alumnus of NIH, all the alumni of NIH, for being in the show. Especially Dr. Nayak sir was very ill. He was having suffering from high temperature a few days back. He was having cough in the morning too. Thank you so much, Eswara sir also, and Rajat is always with us, and Lalit, very grand hosting in sort of all adversity. You saved the face of NH alumni with this note, and we like to return back to the backstage editor and end the stream. And we'll be meeting again on 29th June with the second part of this panel discussion. So good night all.
Good night. Good night. Thank you very much.
Good night, sir.
Thank you, sir.
Namaskar.